Hey, can you see me?
Yeah, can you see me? Someone walked right through me back there.
We might be dead. Are we ghosts?
How could I have done something like this to myself? What was I thinking?
I know, I was thinking I could have done something different too.
I wish I could have talked to somebody.
I think there are places that we could have went.
Can you show me?
Sure.
The ghosts travel further. Will we see more of the ghosts?
Yeah, we were able to use the concept of the ghost to do a bit of a walkabout to key services. And so they've gone on this journey and they actually become the eyes of the viewer. Welcome everyone to Where We All Belong. This morning we have a guest with us, Alan Campbell, he's the manager of the Kwakiutl District Mental Health and Substance Use Services. So welcome, Alan.
Thanks for having me.
Could you tell us about the mental health and addiction, or I think the mental health addiction program of KDC? How does that work, or what kind of services do you offer? Or?
So the Mental Health and Addictions Program with the Kwakiutl District Council Health is a prevention program primarily. However, over the years our programs have broadened, and so we do provide intervention-based services and post-intervention-based services as well. We have as I mentioned, because we serve a variety of different age groups that live within the communities that we serve, we provide a broad cross-section of services, but again, kind of focused on primary prevention, and so our programs and the activities that we offer are often community-based in nature, and we try as much as we can to have as much kind of cultural components involved in any of the programs, and so primary or prevention type programs have a bit of a different flair to them when offered in community with KDC.
So you mentioned that you serve a multitude of communities. Who are the KDC services for? How would someone access your services, your mental health and addiction services?
So Kwakiutl District Council is an executive administrative body that the health component is a small branch of that. So we represent 6 communities across the North Island, from Comox and in and around the Campbell River area, and some rural and isolated communities are also part of Kwakiutl District Council. So in order to access services, often it's through relationship with our clinical sites that we have. We have 4 different clinical sites, and so members from the member nations can access services in person or by phone, and referrals are often made through a variety of different ways. We have strong relationships with our partners off reserve, and so the referrals can come from a variety of different avenues. We've worked really hard to forge relationships with partners, to much the same as this production is about just again to kind of share how our services can be accessed and what exactly they are.
So how do other First Nations people access your range of services? Like, if, for example, status versus non-status people, or people living off reserve, Métis, somebody white but married to a First Nations person, all those complicated other areas of,
Yeah. As I mentioned, the KDC Health is, comprised of member nations that have joined kind of the overall KDC, and so the services are technically kind of offered to member nation members only. However, we practice from kind of a community-based perspective, and there's a teaching that's actually been recently shared with me by an elder in one of the communities that I had the opportunity to work with. The teaching's kind of based on the idea of extending the hand, and so KDC Health practices from kind of extending the hand perspective, in that any individuals that reach out or make contact with us, we don't necessarily close the door if they're not from one of the member nations, and so our work then becomes to connect them with more appropriate services. Those other services that are available are often come from the communities in which they're from, and so sometimes we make contact from other nations across BC. I would even say across Western Canada. We've had people that reside in the area that wish to access services of some kind, and so our work has been to kind of connect them with appropriate resources. In large part, that's working alongside the First Nations Health Authority, who's kind of the overall health authority for First Nations, Inuit, and Métis across BC. So we do a lot of work in kind of connecting them through access points, depending on kind of what the needs of each individual are through the First Nations Health Authority.
So you mentioned earlier that you have a strong prevention focus, but also some intervention and postvention services. So can you tell us a bit more about what those services look like, and whether you have outpatient services or residential services?
Most of our services would kind of be classified as outpatient services. As I shared, we practice from kind of a community-based perspective, and so a lot of our services are offered by way of programs being offered in community to have communities attend. Another large part of the work, though, that we do is health promotion in general, and so offering information to our community members through a variety of different means. We have newsletters that go out weekly. The bands also have newsletters that we share information with. We promote health topics within each of our clinical sites. And so we've really tried to expand on that, because we represent upwards of 2,000 community members as part of the KDC Health as a whole, and so we really look to kind of offer as much information to as broad a population as we can. The community-based program services are often, depending on the nature of the topic, kind of, again, made notices made in our newsletters or on our website, and so community members are invited to attend, and those, we have programs that kind of have different health topics intertwined weekly or monthly, however they're offered. Their focus is based on different health promotion topics that might be important to community, that are requested by community. We also kind of work with the health promotions calendar that's available, and so the calendar kind of highlights some of the national or provincial health promotion topics, and so we often kind of adopt some of them that are relevant for community. And then again, the interest is to kind of share as much information with the community as possible on the relevant topics. Yeah.
Is there a cost for any of these services for people in community?
For the services that we provide in our health offices, no, the services are free to community members. And even the question about residential services, those services, be it that they're kind of the First Nations Health Authority funded facilities, those treatment services are free to community members as well. inpatient services that are outside of the First Nations Health Authority, there are fees associated with that. Often private facilities will have per diem rates that, and so the community members are responsible to kind of find coverage for costs in that regard.
So just to clarify, there are some residential treatment programs available that are funded by the First Nations Health Authority? Yeah, there's a number of treatment centers that primarily kind of alcohol and drug addiction related treatment, but a number of those programs also have other forms of treatment for, say, trauma-based programming and things like that. I believe there's 13 actual residential facilities across BC, and they, there's some in the north of BC, a number of them in the Lower Mainland, some in the interior. We have, I believe, 3 here on the island. One up in Alert Bay in Namgi's territory, and then Sultan Laylam located just down by Nanaimo, I believe, in Lanceville. Yeah. Thank you.
So this program, Where We All Belong, is about local substance use services. How would you say First Nation or Aboriginal substance use services fits in with those services?
That's a good question. I think the perception is often that they're separate, and we still to this date even get people that are unaware, and it appears that there's a boundary between services offered to First Nations, and I think that's a legacy of kind of the reservation system. But as I mentioned, though, we've done a large focus of our work is to focus on kind of better integrating, and so that term I don't want to confuse with other not so kind terms such as assimilation, but so I believe that our services at this time kind of integrate with the other systems that provide services. We have strong lines of communication that we share pertinent information back and forth around programs and services available, and certainly any activities or programs that we offer, we try our best to share that information with our partners that also have clientele that engage with them that might be from some of the communities, and I think vice versa, that we look to kind of get involved or become aware of what's being offered from our partners, and so we try to access the best services we can for those that we serve.
Just on what you were saying about sort of, reaching out and so on, there have been I've attended 2 mental health and substance use conferences put on by KDC Health, and they were, there was a big invitation to those of us that work in other services as well, and those were very incredible, powerful conferences, and it's a really big example of how we can get together and form relationships so that all of us work better on behalf of the people we serve. You know, so.
And the approach that we used was rather unique in that oftentimes integration is seen as First Nations, whether they be community members or professionals working within, learning about the larger system and how to work better with them. And the opportunity that we had to offer the conferences and later the curriculum that we've named Reflecting Towards Change has been about kind of the inverse of that, where we're inviting non-Aboriginal practitioners or professionals to come and learn about different ways of knowing related to health and specifically mental health in this regard. But the response has been somewhat overwhelming in that it was really, really well received. We had a really large number of people interested in attending, and the feedback that we got certainly supported us in continuing on with that work. We, our partners were Island Health originally, and then because of the nature of the work and the response that was gotten later, First Nations Health Authority came on as a sponsor to the work as well, and so we hope that it continues, because again it really kind of flips this idea of working better together on its head, and it really has a much more of a culturally safe tone to it, in that it's not the expectation that First Nations people learn about you know, the ways of knowing that they're to enter into. And I think you know, this the flavor of that is really, we're starting to see that across the board. I think the North Island Hospitals project is a really good example of how they're using that approach to really kind of enhance the services that they're going to offer, and even the space, the consultation that they've received is you know, been really phenomenal. I've been a part of that as well, so it's been great to see.
So you've kind of alluded to some of the reasons, but can you tell us a little more about why you think that the KDC's mental health and substance use services work?
Well, I think they work largely in part because the community members have chosen to engage with our services, certainly. I think part of the reason is that we really do try to honor trust and respect in relationships, and some of the terminology that we get used to using is things like confidentiality and rapport, and those terms might be more clinical or more professional, but really the basis of that, the root of that is really just about respecting another individual and honoring what it means to be in relationship with that person. And back to my comments about integration, that's really how we've come to kind of sum up this idea of integrating with another person. It's just simply to forge a relationship with that person that, again, is, you know, equitable, and it respects that particular individual and where they come from and what their story might be, and their histories. And Aboriginal people in general, as I've come to know, are gifted in doing that, and so that's one of the neat things that has come out of our work, is that we've really been able to see that and been able to share that with a large body of other people that have really become quite interested and fascinated by it. So, yeah.
So, is there anything else you'd like to tell us about services in community, in First Nations community, that maybe we haven't touched on yet?
Well, I don't know about specifics, because that's ever changing. We're always interested in offering kind of the most relevant or the most current of programming itself. I think, though, my offering might be more of an invite, whether that be to other Aboriginal people that wish to know more about the KDC or KDC Health specifically, but as well our partners. You know, that we know that our services are limited or aren't often made aware to other individuals, and so we really, again, invite our partners in the community, whether they be other professionals or community members in general, that if there's a wish to know more, that you know, kind of connecting with is usually the best way to do it, and you'd certainly be welcomed with open arms, because we really like to share the great work that our team does in our communities, and so really, I think that would be one of the things I'd like to offer.
Is there a contact number, if there are any viewers out there, maybe First Nations folks or anybody that wants to work more closely and learn more about community and culture, and so they have a better understanding? Is there a number that we could give to our viewers?
Yeah, I think, I mean, as I mentioned, we have 4 different clinical sites, and so there are different numbers for each of those sites, but I think as a kind of a main contact number, our main office, which is based in Campbell River on the Campbell River Indian Band territory, the number there is 250-286-9766, and if the interest is to be connected to the mental health and addictions program, then certainly they'd be able to forward you on or provide you with other details of contact numbers and fax.
So they get to the main number and just ask?
Yeah.
Yeah, okay.
Alan, if you could describe a compassionate community, what would it look like?
Oh, I think a compassionate community is one that promotes equity over equality, and certainly equity over any privilege or anything of that nature. I think though, and this is in line with some of the work that we do in community, I think a compassionate community also is one that promotes the acceptance of others and their differences in values and beliefs, morals, whatever is comprised of that. And that's really a large part of the work that we've been doing over the long past while, is to really try and promote that with partners and other stakeholders. So.
Okay. So thank you very much for joining us today. That was really informative.
Thank you very much.
Thank you.
Compassionate community. I guess everyone's out there to help each other, and genuinely, sincerely caring. That would be the primary. Yeah, good hearts.
Well, I would like to think that a compassionate community is diverse. More than anything else nowadays, I think that is what we need in our community, is an acceptance and an embracing of diversity.
So when you think about diversity, what do you mean by that?
Right across the spectrum, not only the LGBT, but racial diversity. We live in a beautiful place, and it would be nice to fill it with beautiful people.
When you think of a compassionate community, what does that look like to you?
A compassionate community, I think, considers all of its citizens and the environment and economy in a more of a holistic way, rather than just pushing economics that are based on models that are antiquated, and you cannot have infinite economic growth with finite resources.
I would describe a compassionate community as valuing kind of the elderly and children, lots of activities, lots of inclusiveness, multi-age, multi-abilities, inclusion of diverse sexualities, diverse races. Yeah, that would be a compassionate community, I think.
A group of people who care for each other and move along progress together without leaving anyone behind. I think that's a good example of a compassionate community. Yeah.
Anything else? Imagine yourself living in a community that's very compassionate.
I would feel welcome regardless of what race I come from, whatever religion I come from. I would feel like a part of a big family, I guess.
David, if you imagined a compassionate community, what would it look like? Can you describe it for us?
I'd have to go back in time to when humans lived in cohesive communities rather than fragmented communities. In our traditions, in our cohesive communities, for instance, our leaders were not the boss. They were servants of the community. Also in our traditions, the emphasis was not on the individual, it was on the community. So for instance, every child is taught self-sufficiency, not to be independent, but to be interdependent. So that's self-sufficiency serves the community. The community also has really good problem-solving processes, usually with ceremony. And for a compassionate community, if you don't have that, I don't see how you can have a compassionate community.